You're watching Unrendered on IKTV. I'm Tony Regisford, and my guest is Dr. Donna Brown. She's with the World Pediatric Project and doing some great work here with her team, or as part of a extended team here in St. Vincent and the Grenadines. Yes, Dr. Brown, so we are going into our final segment, and I just want to zero in on some specifics that you would have done this time around, maybe, and what sort of cases have you been really dealing with children?
Some of the cases have been things that I need to do for some of the children that came to the United States already. Children with congenital cataracts, and we've brought them to take care of that. And some of them need a laser procedure in addition, and we can do that here because we have the equipment to do that, and so we would do those under anesthesia. And in an adult, this is something that could be done in the clinic, but of course the little babies and young children can't cooperate. And then a lot of eye muscle surgery, strabismus surgery, crossed eyes, eyes that drift. The misalignment is not a cosmetic issue so much as a vision-threatening issue. When children are born, they're not born automatically seeing properly. And if the eyes are crossed, then often the brain will shut down one eye and not use it. So our goal is to prevent the blindness that occurs secondary to that. And we can do that because it is a very uncomplicated surgery from a chance of a post-operative complication. And our goal is, again, to do everything here that we can do without, once we're leaving, having an issue. So we always see some great cases. A little girl that I did a corneal transplant on from St. Lucia, she came up to the United States to have that procedure done, and we saw her, and she'll come up and have the second eye done in short order, and we were able to
And that's the ophthalmology part of it, but you have other doctors here that are doing different things. What are those different things that they're doing?
Dr. Blanchet specifically is doing several cleft palate, cleft lip repairs. There are often burn contractures. There's some little ones that get burned accidentally, and they'll have a contracture that makes a limb not work or something like that, and she must do skin grafts in order to correct that. So a lot of reconstructive work, congenital anomalies, patients that have congenital anomalies, many of those she can correct here. Some she must bring to Richmond or send to St. Louis as well. But those are some of the things. The urologists are doing some children tomorrow as well. I'm not certain because they did their clinic today, but they have some cases for tomorrow as well.
In terms of what this thing is worth or has been worth to the islands that are served, just statistically, how would you, what is it? Give me a sort of dollar amount in terms of the contribution that you've made on this program, the World Pediatric program, that is.
For the Eastern Caribbean Initiative, or if you go back even farther than that, probably we should, to 2002 when we first started coming to St. Vincent. So in the last 12 years, what we call gift in kind, what it would have cost the patients to have the care. The gift in kind amount for the children that have come to the U.S. to have care is upwards of $22 million US. And the value of the services we've rendered from the visiting teams, diagnostic and surgical, probably around $6.7 million US. And we've seen about 6,000 patients in that 12 years. Done probably close to 800 cases after this week. So it's a good volume. Of course, those first few years when it was just growing and building, we might have had 2 or 3 teams. So it's really exponential, and our hope for the future would be, once we have a designated operating theater, to continue to look for the needs and try to supply those needs, whatever that might be. The orthopedic needs, the scoliosis needs are something that we've really realized is significant here in the region, and so we probably will end up needing to send some extra teams for some of that work. So
you're looking at, over a 12-year period, you're looking at about $28 million US, because you're 22 plus the additional six and a half that you mentioned, and that's US dollars we're talking about. Well, that's fairly significant, and if I may say, that program is certainly an exemplary one that you're doing here. I know that you've been working with the local people here, Nurse Brown. She's a linchpin in your whole organization. She's the one that helps to knit this thing together. And I'm sure there are views that she wanted you to express in this program, but we'll get on to that. But how if you'd put it in words, how would you say that the program has generally impacted the region, apart from the monies that you've pointed out there, $22 million that you've saved us, really?
Yeah. Well, I've asked several people what they would want me to say. Dr.
Yeah.
Donna, Sister King, Jackie King, and even Crispin, who brought me over here today. I said, what does this mean? What does this mean for the region? And Crispin said, it's given lots of joy to the parent who thinks that their child has no hope, and they learn of this program and the child has hope. It has given hope to the region so that the pediatricians know they don't have to go in and say to that parent, I'm sorry, your child is going to die of congestive heart failure. We have a remedy. Even from the preventive programs that we've done, to understand that rheumatic fever is endemic here, and to get a grant to try to prevent that, which is what we've done. That's given a whole new focus of what we do. Let's identify what we can make a difference in from a preventive standpoint. So I think we've given hope. I think we've changed the attitude of acceptance of a congenital anomaly or a child with a significant critical need. We've changed the attitude and paradigm of we'll just give up because there's no solution to now there's a solution or a possible one. And so I think the hope. I think the other thing we've all learned is it takes tremendous teamwork and collaboration, whether it be the civic organization, the government, the hospital, the administration, the physicians, the Jackie Kings of the world, the BDOT. It just so much collaboration. And I think the other thing that I know Jackie wants, she wants all those families who have been helped to then reach out to the next family who needs help, and has established something called the Dove Club. Okay. And she, because that's our symbol is the dove.
Right, and that's the bird of hope, isn't it?
Yeah, and so she wants to say everybody needs to give back, and I guess part of the reason we do that is because we want to give back, but I think in general most physicians and surgeons say, if we have the capacity in our schedule and the capacity in our hearts, we want to reach out and help supply a need where and when we can. So I hope that what we've done is be good ambassadors from the United States to show you that there are good people there, and we want to help St. Vincent because we love the people here. We think the people here are like us. They care about their children. They want their children to do well, and it breaks their heart when there's something wrong with their child, and now we can make a difference. So those are the main things that I think.
And it's good because you incorporate local doctors and local health practitioners in your program when you're here. They also participate. It's not just a team that you bring, but it's also, and there's an element of training as well, I understand. Yes. That you...
The capacity building is critical, we think, and one of the things we did in the Dominican Republic is we taught the adult heart surgeon to do pediatric hearts. So now that is a self-sustaining program. So I operated with an ophthalmologist this week, Dr. Cherise Grant-Ledger, and so we worked together on the cases. And so she is doing more and more pediatrics when I'm not here from a diagnostic standpoint, so that the next time we can do more things together. Right. So our goal is capacity building. We want to train every time we come. We give lectures, and we do this, help them with help the physicians and the house officers with continuing medical education, whether it be a lecture or a training. But there's always a physician in the room with us that can learn what we might be able to teach them, and they're very eager for that. So yes, there's a big capacity building program
that is
component.
Excellent. Just my final question: where do you see the World Pediatric Project going or growing? Are you just going to concentrate now the islands that you're in, the two parts of the world that you're in? You're in Belize and Dominican Republic and so on, and you're here in the Eastern Caribbean. Are you looking at expanding that to more areas of need, or are you going to focus here and, keep building?
A little of both, but primarily focus on here and keep building, because we're not finished here. There's so many more things we need to do. I think we need to have an increased communication and marketing to these other OECS countries so that they can send more kids to us. And when we feel that's comprehensive, I think then there might be a need to look. But I think that's years in the coming. We just added Suriname as a country, and it's my understanding that a child did come here for scoliosis surgery from Suriname.
Okay.
So that's a huge population and a whole additional thing to have to work out. But that has always been in our goal, was to add that country, and we've started doing that. And I think from time to time, countries will come to us when they've heard of a successful program, like Panama heard what we had done for the pediatric heart program there in Dominican Republic, and they said, the government invited us and said, can you do the same thing here, because we have someone interested in learning, and it was an adult heart surgeon who then is learning to do pediatric hearts. So I think we'll probably continue to grow organically, if you'll let me use that cliche, and try to be continue to be good and improvement in what we're doing. We tend to do program very well, and we're always looking for ways to make it better and better. So that's really our focus and our goal, and to continue to have St. Vincent as our hub.
As your hub. You just drew my mind to another question. I did say that was the final one, but as you mentioned, somebody you think came from Suriname, it dawned on me that the program, covers the cost of travel for the patient and the guardian, because it's a child, I suppose, traveling.
It is a child, and there is a guardian that comes, and we do not cover the cost of the transportation.
No, you don't.
Once everything we do, we pay for the transportation for ourselves to get here, etc.
Yeah.
And then all the medical care is
Right.
free. But the patient pays their passage,
Right.
and then once they're in Richmond or St. Louis or whatever, if they've had to come to the U.S., all of that is no cost. We have centers in each place that have free housing for the
What
patient.
happens when somebody comes from, say, St. Lucia to St. Vincent to the hub? How are they accommodated?
The family covers the cost of the transportation, and we have agreements with some of the hotels here in St. Vincent for reduced cost for those people,
Right.
so that they have a place to stay. Often they have family here,
Right,
and
so
they
they
might stay
make their
with
own
family.
arrangements.
But
basically.
they do, and the facility of that is done by Jackie King and her colleagues who do similar work.
Right.
Even if they're not our full-time employees or even part-time, she has contacts
So
there.
she has a team that does all the ground logistics,
Correct.
where the people are going to stay, et
That's
cetera,
right.
et cetera.
That's right.
Well, it's been a pleasure talking to you, Dr. Brown, and I wish your program or project, continued success. It's great that you've chosen St. Vincent to be the hub, and I hope that by itself spurs a lot of other things generally in the healthcare facilities here in St. Vincent. So
Thank you.
it's been a pleasure.
Thank you for the opportunity.
Thank you
I
very
really
much, and I
appreciate
wish you all the best.
Thank you.
Thanks. This has been another edition of Unrendered. My guest was Dr. Donna Brown. She is with the World Pediatric Project, and they are doing some fantastic work here in pediatrics here in St. Vincent and the Grenadines. I'm Tony Regisford, and you're watching IKTV. Do join us the next time Unrendered airs.